The information in this video will help you to understand what the Patients Association Nutrition Checklist is and how it can be used. The checklist was developed in 2018 to help people over 65 living in their own homes and staff working in health and social care to identify the potential risk of undernutrition by encouraging conversations around food and eating well. The checklist is made up of two parts. Section A is designed to help you identify individuals at risk of undernutrition. Section B provides further questions to assess physical and social needs, such as difficulties with cooking, eating, or shopping. Section A includes 4 simple questions to see whether the person has lost weight unintentionally or is underweight. These questions have been validated against the Malnutrition Universal Screening Tool, so it's recommended to use these questions as they are presented in the checklist. The 4 questions from Section A can be embedded into existing assessments, enabling you to provide support to a person in your care early on. The use of this screening tool has been identified by the Care Inspectorate as good practice and has been found by care organisations across Scotland to be beneficial to the people they support. These are the 4 questions. Question 1. Are you or your family concerned that you may be underweight or need nutritional advice? Question 2. Have you lost a lot of weight unintentionally in the past 3 to 6 months? Question 3. Have you noticed that your clothes or rings have become loose recently? Question 4. Have you recently found that you have lost your appetite and/or interest in eating? If the person answered no to all of these questions, then no further action is required. However, if the person answered yes or don't know to any of these questions, then this indicates that they may need extra support with eating and keeping nourished. If you have identified that a person could be at risk, it's important that they are provided with support and information as soon as possible to prevent further weight loss. This should be done through your organisation's usual reporting pathway and recorded in the person's care plan. Section B is designed to help identify underlying issues and offer some easy steps for you to suggest. These will help the people you support to gain weight healthily or to keep their weight steady and get the energy and nutrients they need. Section B may also be adapted for your situation and local services. What do you look for when addressing older people's dietary and hydration needs?
I think fundamentally we would look for the provider to be gathering information about the person, really looking at what was affecting them in terms of their nutrition. Their likes and dislikes, that would be a relatively easy kind of starting point, but also thinking about other factors that might be affecting their nutrition at any given time. That might be environmental factors, financial factors, dental factors, mood, pain, and taking all that information and really trying to establish what the risks are for that person and how to mitigate against those risks. So with that information gathering, the next step would then be to make sure there was accurate recording of the information and accurate recording over time. So making sure that note keeping and things were on point.
How important is nutritional screening?
Nutritional screening is really important for older people. Making sure that you've got a baseline of somebody's nutritional needs and nutritional state at the start of providing care provides you with that benchmark that you can move on from over time and some way to measure change, whether that's positive or deterioration for the person. I think with using a screening tool, you get a common language between the individual, the carers and the multidisciplinary team so that you can communicate easily when changes are taking place or when somebody's needs are increasing over time.
What is current best practice when addressing malnutrition or dehydration issues?
I think the central focus has to be the individual, making sure that you're involving that person in discussions and decisions around their nutrition and involving them in your aims and objectives, if that's to gain weight or whatever it is that you want for the person, then making sure they're central to those conversations. That might also include involving their family if they have influence as well. It's really important that staff are well trained and that they understand what you're asking them to do and why they're being asked to do it. And that really gets a lot of buy-in from staff then if they can see the benefits of using tools and measuring people's change over time. I think that it's crucial to make sure you're following your local processes and your local guidance, because that means that your referrals are correct and your processes match those that are expected of you. Lastly, we would hope that you would be able to use the resources that are available on the Care Inspectorate Hub. You'll be signposted to different organisations, different resources that staff and carers and the providers can use to really help make nutrition positive, easy to understand and successful for the people that you work with.